guys, I'm Dr. Taslina. Today we are discussing about calcium deficiency, how we will diagnose clinically in deficiency and how we can manage with homeopathic medicines, and which are the patent medicines which usually we can prescribe for calcium deficiency and we will get the good results. Those things and all we are discussing today in today's video. Calcium deficiency, called hypercalcemia, occurs when the level of calcium in the body becomes too low to support normal physiological functions. Calcium is essential for the strong bones and teeth, proper muscle contraction, nerve signaling, and blood clotting. Cause of calcium deficiencies are inadequate dietary intake. That means you are not taking properly dairy products or other calcium rich foods. Vitamin D deficiency. Vitamin D deficiency can also lead for the poor absorption of calcium. And hormonal disorders, especially parathyroid gland problems, chronic kidney diseases, certain medications like anticonvulsant medicines and or steroid medicines are also can cause calcium deficiencies and poor absorption due to some intestinal diseases, which can also lead to calcium deficiency. Symptoms of calcium deficiency. Early signs can be mild, but severe deficiency may lead to muscle cramps and spasm, numbness or tingling of fingers, fatigue and weakness, brittle nails, dry skin, tooth decay, and in severe cases, seizure and abnormal heart rhythms also can be present. Calcium deficiency affects the multiple systems of the body. The clinical picture can range from mild neuromuscular irritability to severe life-threatening manifestations. In neuromuscular symptoms such as includes the tingling and numbness, especially around the mouth, fingers, toes, and muscle cramps and spasms. In children, mainly they will complain you about after playing until evening time they have aching and pain in the calf muscles, which is the major one symptom due to calcium deficiencies. The kids, if they are not playing that much, also if they are not taking much muscular exertions, also they will be having constant calf muscles aching, which may be due to calcium deficiencies. And tetany, involuntary muscle contraction, twitching of facial muscles, carpopedal spasm, and hyporeflexia, seizures will be presenting. Cardiovascular symptoms like palpitation, prolonged QT interval, and arrhythmias, hypotension in severe cases, and skeletal symptoms like bone pain, fragile bones, increased risk of fractures, deformities in children, bone thinning as osteomalacia. Calcium deficient patients, we can see the irritability, anxiety, depression, poor memory, confusion if the calcium deficiencies are very severe. Skin can also damage, dry, rough skin, brittle nails, hair fall in coarse hair can be present, and dental changes, delayed tooth eruption, and weak enamel and tooth decay. In severe cases, the laryngospasm, convulsion, and cardiac complications also present. Why calcium is important to our body? Calcium plays the key role in bone strength and density, muscle movement, heart function, and nerve communication. Main sources of calcium like milk, curd, cheese, green leafy vegetable, example spinach, and almonds, sesame seeds, and fish fish with bones. The main source of calcium is sardines. In Malayalam, we used to call it smatti, and fortified foods. Role of vitamin D. Vitamin D helps the body absorb calcium effectively. Sunlight exposure is one of the best natural sources. Best management is to improve the diet with a calcium rich food, ensure adequate vitamin D and sunlight or supplements, and treat underlying causes and supplements if needed under medical guidance only. If a very mild level of calcium deficiency, we can correct it with the food, dairy products, green leafy vegetables, fish with the bone. These things and all you can advise during a consultation if the calcium deficiency is too less. If it is a severe case, along with the diet management, you have to give the homeopathic medicine also. The major medicines are calcarea carb, which is one of the most important remedy suited to weak bone development, delayed dentition in children, profuse sweating of head, fatigue, obesity, sluggish metabolism. It can be used in conditions like rickets and early osteoporosis also. And Calcarea phosphorica, best for bone growth and repair, indicated in thin, weak individual, growing children with a bone pain, decayed union of fracture. Excellent for nutritional deficiencies affecting bones. And Calcarea floor act on the bone elasticity and hardness and used in weak enamel and bone deformities and ligament weakness. And Cilicia help in assimilation of nutrients and indicated when the poor absorption despite good diet and weak nails, hair and bones delayed healing. And phosphorus individuals with weak bones, nervous exhaustion with a burning sensation. Also useful in bone degeneration also. Natrum mur, the chronic nutritional imbalance suited to thin individuals, weak despite eating well, emotional sensitivity also. Magnesium phosphorica is muscle cramps and spasm due to low calcium. And the patent medicines which are you commonly good results what we are getting from the Fort's Filcal D tablet is good. If the patient having low vitamin D, so first you have to correct with the vitamin D. If vitamin D levels are too low, means you have to prescribe vitamin supplements. You have to prescribe supplements. If you want to prescribe homeopathic supplements, we are with the vitamin D. We are Bakeson's one strips tablets are available. Vitamin D plus available, which is 600 IU, which can be used daily.